welcome to the Palliative Medicine Clerkship. I'm Dr. Christian Furman, and I'm the director of the Clerkship. I'm a professor of geriatric medicine and palliative medicine at UofL, and I'm the medical director of our Traeger Institute Optimal Aging Clinic. And we're very, very excited to have you with us. And we're so excited that you get this opportunity to learn palliative medicine before you start your residency, because it will be invaluable. So I also wanted to explain who else you'll be working with. You'll hear from Laura Hollyfield. She's the program coordinator for the clinical part of the rotation. And Allison Phillips is our coordinator for the modules that you'll do online and also for the ICOPE curriculum. The ICOPE is our interdisciplinary curriculum for oncology and palliative medicine education. And there's two parts of this curriculum. One is the reflective writing, and one is the ICME, the interdisciplinary case management experience. So all of those three components combined make up your palliative medicine clerkship. So after you finish all those, you'll get your grade in your clerkship. I also want to kind of just communicate the goals of this clerkship and also your responsibilities and expectations. So the goals of this clerkship is to communicate with patients, team members, and families in a palliative medicine setting. And the second goal is pain management, an introduction to pain management. And you'll learn pain management through actually having an actual patient that you'll manage the pain on, or a vignette that you'll work through a paper, pencil questions. And that vignette is in your syllabus. So make sure at the end of the rotation you've done your vignette and you've learned some of these communication skills. You're not going to learn all of palliative medicine in this short clerkship. So specifically, your expectations is the week before, you need to contact your site supervisor. The clinical rotation starts on a Monday. We do not want you contacting people Friday night, Saturday, or Sunday. So plan ahead the week before, contact the site supervisor, because you need to know exactly where to show up the first day. You have to complete your Red Med task online, so make sure you do all that the week before. Also, you need Epic for your Norton rotations and now for UofL rotations, so make sure you have that accessible prior to your start date. And also just know that Norton's rotations will require you to go different places, to Audubon and downtown, so be prepared for that. For snow days, we did have snow days in the past, and you will not be required to make up snow days, but you will be required to do reading assignments to make up and learn some more palliative medicine, and those will be listed on our website. So the 1 week clinical experience, it's 5 days, and so the requirement is that you have to be there 3 of those days. And so if you're not going to be there 3 of those days, you're going to have to make it up, because we really want you to learn palliative medicine before you graduate. And if you have to be absent for an ICOPE session or for an interview, you have to communicate that to the site supervisor and to Laura Hollyfield prior to your start date. And ICOPE is a 4-hour session, so sometimes it's in the morning, so you'll go to your clinical site in the afternoon. Sometimes it's in the afternoon, you'll go to the clinical site in the morning, but you just have to communicate that. Please read the syllabus, and so you know what to expect, and it has that vignette at the end, and we'll do that usually on Friday, your last day, but you can do it anytime during that week. There is going to be a learning library online where this video is housed, so that way you can read more to learn more about palliative medicine. The other thing is our conference, our palliative medicine didactic conference, is on Thursday afternoons. It's going to be in person and virtual, so all the information about that is in your syllabus. And it's a pulmonary conference room, which your supervisor can tell you how to get there at UofL Hospital. The big thing is when you're on this rotation, you're going to be in family meetings, you're going to be working with the interdisciplinary team, and you need to pay attention and be prepared to present a patient whenever they want you to present a patient. And each rotation that you're going to be going on has a different experience, but all the rotations want you to be attuned and attentive. And when you're playing on your cell phone, it's a distraction. And sometimes you're not playing, sometimes you're checking messages, you're looking things up, but either way it's a distraction. And so your phone needs to be off during family meetings, it needs to be off when you're learning, and we want you to show respect for your faculty, for the families, for the patients. We want you to, body language makes a difference, so please show that you're interested, especially in family meetings. I've had students falling asleep during a family meeting, and it's very, very disrespectful. So please be attuned to all that. And last but not least, I wanted to thank everybody that's involved in making this clerkship possible, specifically Dr. Ann Shaw. She's our Vice Dean for Undergrad Medical Education, and she has kept this going. It started off as a grant, and now we've been able to have this as a clinical experience for you all. I want to thank our partners, UofL Health, UofL Hospital and Jewish Hospital, where you'll rotate, Hospice Health, where you'll rotate, Norton's Healthcare, Audubon, Downtown, and Children's Hospital, where you will rotate, Baptist Health, the VA, Trover. We have 160 or so medical students, so to give all of you all this experience, we have to have a lot of places that we partner with, and we appreciate all of our partners. We appreciate the physicians involved, the nurse practitioners, the social workers, the chaplains, the psychologists, our PhDs, our faculty, our researchers. So thank you all for all your work, and as a student and as a learner, I hope you have a wonderful experience. If you have any questions or have any concerns, please contact me or Laura Hollyfield. Thank you.